Good morning. Myself Salni, studying at Erode Sengundar Engineering College, final year biomedical engineering. Today's we are going to see about our seminar. So our seminar taking a subject is brain computer interference and applications. So next we are move our title. Our title is stroke rehabilitation using BCA. BCA is a nothing but brain computer interference. So, before we are entering into our topic, we are everyone know what is meant by stroke. So, this is definition of stroke. The stroke is a medical condition that happen when a blood flow to the part of the brain is blocked or interrupted. So, blood flow is blocked or interrupted in our brain region. So, we are everyone know that time we are cannot move our normal functions actions physical actions in our body, so causing the brain cells to loss of oxygen and nutrition. So that time the blood flow is interrupted, that time the brain is having the does not sufficient oxygen and nutrition. There is a no sufficient oxygen and nutrition, that time our brain function is totally stopped. So our body full of physical activities is also affected. As a result, the brain cells begin to die within a minute. Sufficient oxygen does not flow that place. That time all cells are die within a minute, leading a loss of body functions controlled by the part of brain. So, introduction. This is the introduction of stroke rehabilitation. Stroke often causes in the motor impairment due to the damage in the brain region. Controlling movement, traditional physiotherapy helps to make slow or incomplete. These types of traditional physiotherapies is a slowly improved our brain activities. So, brain computer interference technology offer the modern solutions connect the brain directly to the external devices to support motor recovery. These types of systems we are already know in our cardio activities as stopped. That time we are using the Holter monitor to monitor our cardiac actions. These Holter monitors also detect their heart functions activities. So that type of devices, external devices, we are fixed into our brain regions. BCA systems detect the brain activity usually from the EEG. The EEG is nothing but electroencephalogram and it translates the patient motor intention into the digital commands. These activities, virtual or robotic movements. Some patients having some type of physical activities. Some patients there is a no physical activities, only in a eye movements. So that time we are using these types of rituals, and robotic movements is also using in having small physical activities. Physically both help the brain relearn the neural pathways. The in our brain region we are fully presented in a neurons, so that time helping the brain relearn the neural pathways. So BCA is an brain computer interface detect the brain activity and converted into the commands. The brain give a commands in every organs is work under the only brain commands, so that time our brain interference using to detect the brain commands allows communication without the physical movements. There isn't any no physical movements. That type of patients also we are using this BCE method. Uses the EEG, ECOG and invasive electrodes. Then some electrodes are placement in the brain regions. 10 to 20 leads and electrodes. BCA for the stroke rehabilitation helps reactive damaged neural pathways, allows training even when a patient cannot move physically. Patient cannot move physically, that time we are also using these BCA systems, provide the real-time sensory and visual feedback, accelerated the neuroplasticity. Then stroke effect. What type of effects are affected one patients having these types of stroke disease? That time what type of body parts are affected in the patients? Loss of motor control in our hand, arm, leg. These three parts having fully controlled in a motor actions. So these motor actions loss reduce the muscle strength. There is no muscle strength to the patient stand, walk away and in. Limited coordinations, difficulty performing daily activities. Some patients, these stroke affected, they are difficulty to performing their regular activities. Cognitive impairment. This is the some common stroke affect the bodies. Confusions, severe headache, face dropping, blurred vision, trouble speaking, paralysis, loss of coordinations. Uh, some these types of effects are present in the body. So what is the type of BCA used to detect the brain regions? How to help the external devices to detect the command of brain? So that time we are using the three types of BCAs. What are imaginary BCAs? Then P300 BCA, SSV EPBCA, Spatial Imagines Movement, EEG detected, robotic FES. Then P300 uses the visual stimuli. SSV VEP BCA uses the flexuring visual stimuli. Then the motor imaginary approaches, the patient's imaginary hand arm movements. EEG identify the specific motor cortex patients. The system translate intention into the virtual or robotic movements. Then repair trials help brain relearn movements. What is mean by P300? The P300 in the brain computer interference systems that uses the P300 event related ERP. It is one of the most reliable, widely used in a BCA methods is the communication under control. P300 is commonly used for the brain commands communication controls. The SSV EP is nothing but steady state visually evoked potential. The steady state visually evoked potential is the brain response generated into the visual cortex when the person look at the respectively fluctuating visual stimuli. The fluctuating frequency constant. Sometimes of our brain and high we are having these types of activity fluctuations. So occipital hand support the controlled finger movements using DCA motors, U frame and was shape the click and thigh frames. Encourage the correct motor patterns, track the progress via sensors, image suggestions, the robotic gloves or exoskeletal assist to a patient. Then functional electrical stimulations. These types of functional electrical stimulations are using in the FEC, the P3 methods. BCA detect the motor instead sends the electrical stimulations to muscles. These functional electrical stimulation, the stimulation is nothing but stimulate the particular part. These electrical stimulations is given electrical energy to the muscles regions, produce in a real-time movement. Even in a paralyzed, the paralyzed patients does not move one place to another place. That time also we are producing in a external electrical stimulation. Image suggests electrodes on hand stimulating the muscles. This is the common block diagram of generic brain computer interference for the stroke rehabilitation system. Human subject, signal acquisition, signal processing, the motor imaginary classification. These imaginary classification having two types, machine learning models and deep learning models. Then the control interference. Control interference we are using sense control commands to operate the external devices. Some other control devices are used. We are in previously look about the electroskeletal muscles, arms and functional stimulations. These types of some control devices. Then Virtual reality, it is mainly used in a not physical moments. So that type of patients we are using these virtual moments provide the immersive virtual tasks games motivated track accuracy speed and consistency. The stroke patients wearing the VR headsets they interact with the rehab games. These types of virtual realities also used in some realistic games. Headsets, we are also fixing a headsets and glasses are wearing, then interact with rehab games. Neuroplasticity enhancements, these types of BCA also enhance in the neuroplasticity enhancement. The brain form new neural connections. Feedback from the BCA strengthen the pathway. Repeated training uh, rewires damaged area. Image suggestions, brain highlighting growing and neural connections. The real time feedback loops the connecting. We had previously looked about the block diagram, human uh, devices, then the machine learning and deep learning, some control devices. So these types of real-time feedback, patient intention, BCA detection, device actions, display feedback. Repetance improves accuracy. Image suggestions, loop diagram showing the feedback cycles. Then the clinical evidence and the results. Studies show a significant grip strength, wrist movement, arm coordinations. We see increase the recovery 20 to 40%. The chart showing improvement percentage. Image suggestions, we are looking the chart. The chart showing improvement percentage. Then the limitations and the challenges of BCA rehabilitation, EEG noise and signal instantly. We are fixing the some electrodes in the head region, scalp regions. That type of that time we are facing some EEG noises. The electrodes does not place. The patients have movement. That time we are facing noises. Required training operated and patient fatigue reduced accuracy. Expansive setups. Image suggestions. EEG signals with noise speaks it. Future improvements, we are also AI powered adaptive BCA, wireless dry electrodes, affordable home based rehab systems. The affordable home based systems is the highly expecting devices, integration with the smart sensors and IoT. And in our current generations, in all devices having these types of sensors and IoT systems. Image suggestions, wearable EEG devices. Then the application beyond stroke. What type of application? Spinal cord injury, ALS, paralysis, prosthetic limb, and a neurofeedback for learning and gaming communications. So that's all our topic. Today we are learning what is rehabilitation and how the rehabilitation is affected some brain parts and also body parts. So that's all our topic. Thank you.